Noni from Croaky here at the Safer Care Victoria conference called #GiantSteps19, and I have here a very important person on a day like today. Alan, could you introduce yourself, please?
Certainly. I'm Alan Eade. I'm the Chief Paramedic Officer for the State of Victoria, and I'm based with the other clinical chiefs, some of whom you've already met today, at Safer Care Victoria.
Now, what does a day like today mean for your job? And perhaps if we could first sketch the day, because Victoria's come lucky last really in this terrible weather event that we're having this week. But could you sort of describe the conditions that are outside the door for us?
Certainly. So today is really hot in metropolitan Melbourne, but if you look across the whole state of Victoria, we have catastrophic or code red fire conditions across the Mallee and the North Country. We have severe or very high fire conditions across the rest of the state. On top of that, our pollen count across the state is today at extreme, so we have lots of people who are suffering with hay fever and allergy. Because there will be a wind change later in the day, the episodic thunderstorm asthma risk for the majority of the state is at moderate, but parts of the state, the northeast, are in high. And so we have a range of environmental conditions that just on today that are all coming together to create real challenges for not only the emergency services but for the health system.
And we know what that's been like. We've been watching it interstate, but it also comes, it's 10 years pretty much to the 2009 bushfires, so that resonates, and we haven't had a code red, I don't think, since then.
So we haven't had a code red since we had the option to have a code red,
yeah.
Which came in as a result of the 2009 Black Saturday fires. And to have two regions go into code red today is unique, and certainly not something that we're hoping to see repeated.
So what does that mean for your work?
It doesn't mean a great deal for the change of my work. It means that I change my focus and my attention to keep an eye on the health and well-being of the system, and ensuring that we have all of the out-of-hospital care available to support not only emergency services agencies that are operating and in place and are fully optimised as best as they can, but that we have the necessary supports for the community, because it's a really tough day, and so we know that emergency health care is going to be something that people are reaching out for today because of either the heat or the fire or the air quality or the weather conditions. All of those things usually make people want to go reaching for assistance. So.
And that was Victoria really experienced that with a thunderstorm asthma attack. Do we call it an incident that was the worst ever in the world, and the system couldn't meet it, could it?
So in 2016 we had an episodic thunderstorm asthma event, and it was unprecedented. I think it's probably, there's no other way to describe it. The volume of work that was generated for emergency healthcare in such a really short period of time, the system was stretched beyond its capacity, and so following on from that, we've learned a great deal, not only about episodic thunderstorm asthma, because we really didn't have systems in place associated with it prior to that, but that how we can scale the system up for all kinds of emergencies where sudden, unpredictable or unprecedented volumes of work descend upon the system. And so I think not just for the thunderstorm asthma risk, but across the health system in Victoria, we've learned from our natural hazards and our natural risks to make us a much more resilient state than we have previously been.
And yet we know that it's getting more frequent, more severe. How do you make sure that the systems can do it? And can you do it at a state level? Because we don't have a national climate health strategy, as we know. How do you make it happen?
We have to be able to manage all emergencies in all communities, and to achieve that we can't focus on one specific outcome. It is true that our fires are starting earlier, our weather events are more prevalent, but we just don't focus on individual activities. We use all of our emergency response agencies, all of our health infrastructure, and we coordinate all of it so that we can bring everything we possibly can to bear on all emergencies, no matter where they're occurring or which community they're occurring in, so that we keep as many people safe as possible.
So where are the gaps? What would you like to see step up more? Where do we want more responses? Where do we want more resources?
if we can avoid having emergency healthcare needs, then that is always going to reduce our or give us greater capacity for where emergencies do happen. If we can prevent people getting sick, if we can avoid people needing urgent healthcare by better management of their healthcare when they're well, and preventative activities, we'll always do better. It's an area that doesn't get as much attention as most people in healthcare would prefer, but if we can prevent people getting sick in the first place, invariably our emergency resources are more available and more attuned for dealing with crises as they present.
So where would you like to see that happen first at the moment, or most urgently?
I think there are so many areas that we could tackle. I'm not sure I'd do anybody any justice by picking one. Today, I don't think it's about large-scale health prevention across in any particular area. I think it's about making sure people understand that we can do things in a short, preventative way by hydrating, keeping in the shade, staying out of the sun, making sure we've got our prescribed medicines with us and taking them as we're supposed to. These are all things that sound really simple, but some people struggle to achieve. And these will be what stop you getting exposed to the heat and a fire risk and the air quality risk and the pollen and the thunderstorm asthma risks. They are all likely to reduce your risk in these quite challenging days.
And do you have a big focus on the social determinants? So, we know that better housing is better, that keeps people safer in hot and cold weather. Those sorts of issues, infrastructure, do you work at that level? I
get consulted to talk about how we can best support all people across the state. And insecure housing is well regarded. Emergency healthcare, frequently things like alcohol and drug use. Insecure housing is one significant factor in that particular population. But social determinants affect all of our healthcare. And if we were seriously going to talk about preventative health, as I mentioned earlier, then improving people's social determinants is just part of preventative health.
Fantastic. Now, apart from the day's events and the day's weather and the day's risk, what's this conference mean for you? What are the big issues for you beyond weather?
For me, I was a real fan of the opening from Ewan Wallace around who's caring for the carers and the focus on the well-being of the workforce who are working really hard at trying to bring excellent high-quality care across the system, whether that be in acute health, subacute, rehab, community and services, across the breadth of what we're discussing today. We have to look after the people who are providing that care, and mental health, well-being and resilience of our workforce needs to be supported.
Fantastic, Alan. Thank you very much.